Thank you very much. So we're going to move on to talk about the last project. Can I have the slides, please? Yep, thank you. So this last project is an integrated knowledge translation project that aims to develop an online portal to engage the public in generating research questions. This is what we call multi-method cluster project within the support unit, and as you can see there, the project leads include myself as well as Dr. Leanne Curry, who is the lead of the Data Science and Health Informatics Methods Cluster, and Dr. Aaron Michalik, from both Dr. Curry and Dr. Michalik from UBC, and Dr. Michalik is the lead of the Patient Engagement Methods Cluster. We also have two researcher partners from Simon Fraser University, Dr. Chris Shaw and Dr. Diane Gramella. Both of them are experienced computer scientists and have a lot of insight into how to make web-based portals user-friendly and engaging for a variety of populations. We also have three very engaged and highly skilled research users in terms of their expertise in social media and digital media tools. Cheryl Cohen is the president of Arthritis Consumer Experts, Delia Cooper from Patient Voices Network, and Sunny Liu, who is from the Patient Council of the Support Unit. Next, please. So at the core of integrated knowledge translation is the practice of engaging knowledge users throughout the research process. Now, as we know, public and patient engagement in research has been credited for a number of good things, including its ability to illuminating new areas of inquiry, as well as improving the ways that we plan and conduct research and how we do knowledge translation in sharing evidence. A recent systematic review has noted that a lot of these patient engagement activities actually concentrate at the preparation stage of the research process, such as setting research priorities. There are a variety of ways and strategies that people use at this particular stage, anywhere from engaging knowledge users such as patients and caregivers in informal consultation, all the way to large organized activities such as the priority setting activities used by James Lind Alliance. Now, these are great strategies, but a limitation of them is that the ideas that are generated from these type of activities usually will reflect the perspectives of individuals who are invited and present in the process, but it may not represent those of the larger target population. So, next please. So to address this issue, there are actually a number of commercial websites that are available to allow people to network and contribute in health data with the ultimate goal of generating useful research questions for a variety of conditions. So, for example, web portals such as the one that you're looking at called Patients Like Me, this particular portal is currently engaging 600,000 people around the world in generating data. So people can log onto the website and they can report their symptoms, the severity of their conditions, what kind of treatments that they've been using, as well as how effective they are as they perceive it. People can also contribute qualitative data such as their own stories in managing the disease. Now, this type of platform provides a really powerful platform, a forum to collect a massive amount of data that could be used to generate research questions and hypotheses. And it is particularly useful for rare conditions. So, for example, lupus, that it affects 1 in 2,000 people, is actually incredibly difficult to find individuals and engage them in the research process. But in Patients Like Me, as I checked a few days ago, there are 30,000 people contributing data about their health. So one of the issues of these type of websites, however, is that they're usually privately owned. and not accessible to the academic research community. Next, please. So within the BC Support Unit, we have created a citizen science initiative, which involves expertise from knowledge translation science, data science, and patient engagement. The vision of this initiative is to transform how patients and the public can be engaged in generating research questions. And the way we do it is to develop a web-based portal based on the citizen science approach. So dated back to around the 1990s, citizen science can be broadly defined as a social movement in which the public are actively engaged in scientific activities through their knowledge, their intellectual effort, their resources, or even by contributing their own information, such as the health-related data and lived experiences. The use of or the popularity of wearable devices, for example, is one of the type of tools that helps to engage the public to generate a large amount of physical activity data, which could be used for a variety of analysis to generate research questions related to people's lifestyle, for example. So as mentioned, this project, it involves 3 methods clusters. And for the part that is led by KT in implementation science, our objectives are to create a user-friendly, please go back to the last slide, please. To create a user-friendly front end for a web-based portal for people to rate different aspects of their health and also to contribute narratives of their health-related experiences. We will conduct usability tests for the web app to make sure that it is user-friendly and engaging, and also to evaluate the feasibility of using these type of apps to collect data from the public. Next, please. So the development of this, the web app data architecture, as well as the patient engagement methodology, will be detailed in the work plans led by Leanne Curry and Aaron Michalik from their methods cluster. So for KT and implementation, we focus on the app development. So we will apply the best methods of design thinking to create a product that is both easy to use and engaging for the public. And we will also apply a rapid prototyping approach, which involves engaging or interacting with, having users to interact with the evolving prototype so that the developers can continuously find out and further develop components that works for the target users. We will then test the user-friendliness of the app prototype with 20 people, 10 men and 10 women in BC communities and individuals with at least one type of chronic condition or disability. And what we will do is to observe the way that they interact with the app and make further refinement before we then release it to the real world, and where we're going to recruit 50 people to test the feasibility of using this app to engage the public in contributing data. So specifically, we are going to measure, assess the acceptability of this type of tool by interviewing the participants in the feasibility study. And we're also going to track their usage data to see how they interact with the app functions. We will look at the implementation as the feasibility outcome, so we will assess how fast we can recruit the 50 people, as well as the number of technical issues that they report or they experience when they use it in real world. And finally, we will assess the practicality of the tool by recording how well these participants are able to follow the app usage protocol.